Interviewing children and adolescents. There are many similarities between adult patient interviewers and those of children and adolescents. Basic organization of the medical history should be taken. We should always use professional guidelines for the interview and demonstrate empathy and respect for each patient. The differences between adult patient interviewers and those of children and adolescents are based upon the stages of physical, psychological, and emotional development. Development of these patients as they progress from infants to toddlers to school-age children and finally to adolescents is going to vary, and knowing how to adjust our communication for each one of these is extremely important for gathering information. Infants and toddlers. The patient is the focus but not the participant. The parent or the guardian provides most of the information. It's helpful to have the children present to prompt the parent's recall of relevant details. So in this situation of infants and toddlers, it's going to be the healthcare provider, whoever's caring for that patient. It could either be the parents, grandparents, or older siblings. In terms of school-age children, many children are able to contribute substantially to the patient interview by the age of 5 or 6 years old. Information must be verified by the parent or the guardian to ensure its accuracy. In terms of adolescence, teenagers take increasingly responsibility for their own health and health care while parents' roles diminish. In other words, the teenager starts accepting more responsibility and starts giving more detail, and the parents actually sit back and monitor. They assure that the adolescents are giving the correct information and that the conversation is confidential. And this falls under our HIPAA Privacy Acts. Information regarding drug and alcohol use, sexuality, and behavior, also emotional issues, can be obtained directly from the adolescent. We want to avoid closed-ended questions because we don't get as much information as we use open-ended questions. Interviews must be conducted with the utmost discretion to ensure the patient confidentiality. Violations of confidentiality damages the trust between the patient and the healthcare provider, and it can also result in lawsuits. We've discussed HIPAA in the past, and this is the Health Insurance Portability and Accountability Act of 1996. This ensures the security of patient information. Hospitals, doctors, and all healthcare providers must guard against the misuse of a patient's identifiable health information and limit the sharing of such information. This information can include patient name, date of birth, social security number, and diagnosis. Discussing a patient with an unauthorized individual is a violation of the patient's privacy. And this concludes our section on Chapter 8, the interviewing and technique skills.